Hi, everyone. My name is Dr. Donovan Maust. I'm a geriatric psychiatrist and a professor of psychiatry at the University of Michigan. So today our topic is benzodiazepine tapering in patients with co-occurring mental health and substance use conditions. So if you've read the Joint Clinical Practice Guideline on benzo tapering, you hopefully appreciated that we really try to emphasize that tapering is a decision that you make with individual patients based on their own personal risk-benefit balance. So these two sets of conditions, mental health conditions and substance use conditions, are a good example of how this decision is not the same for everyone. So for example, for someone with a mental health condition, I would probably start from a position of, it's possible that this benzo offers benefit for that condition, for that patient. And so let's think really carefully about whether or not tapering is appropriate. In contrast, for somebody with a substance use condition, I'd be more likely to be skeptical that the benzo is appropriate and feel more strongly that tapering would be the right decision. Many patients with substance use disorder have a mental health disorder, and vice versa. This can make it particularly challenging to weigh the risks and benefits. In such cases, consultation with an addiction psychiatrist or other specialists with expertise in both substance use disorder and psychiatry is recommended. So really, for any taper with any patient, the fundamental question that you want to answer from the beginning is, why is this person prescribed this medication? This might seem really obvious, and of course, a clinician and patient would know the answer. But in some cases, especially if you inherited this patient from another clinician and they've been on the benzo for years or decades, you actually might not know. And so that's really where all these conversations should begin. On the substance use condition front, why there's such concern here is because of the potential for overdose in particular. So if you look at pharmaceutical overdose deaths, benzos are number 2 after opioids for the medication class that's involved. A lot of those overdose deaths, about 3/4 of them, do involve an opioid. But then you have a quarter of overdose deaths with benzos on board that don't involve opioids. Probably there are other types of CNS depressants on board, such as alcohol or other sedating medications. But of course, this is a higher risk for patients with substance use conditions. One important point to note is that in 2017, the FDA clarified that medications for opioid use disorder should not be withheld from patients who are prescribed long-term benzo treatment. So since we're talking about substance use conditions, I just want to point out that if medications are appropriate to treat opioid use disorder, those should not be withheld in patients who are on long-term benzo treatment. If we move to mental health conditions, again, you want to start from understanding, why is this patient prescribed the benzo? And maybe start from a place of caution about whether tapering is actually the right thing to do clinically. For example, is this a person with severe generalized anxiety disorder who's had multiple adequate medication trials of other medications to manage their anxiety? They've actually had psychotherapy, and really the only thing that helped manage their anxiety and help them function was a benzo. So if they're doing relatively well and they don't have other significant risk factors, like they're not co-prescribed an opioid, they're not 75 years old, maybe actually tapering is not the right decision for that individual. So again, the key is really to understand, what's this patient's diagnosis, what's their treatment history, how successful or not have benzos been in treating their condition. One important point to note that I think is a surprise to some people is that benzos are not an appropriate treatment for PTSD. And so when you're thinking about what might be an appropriate condition, I'm thinking things like severe generalized anxiety disorder, panic disorder, maybe some cases of bipolar disorder, but just want to underline the point that PTSD is not an appropriate indication for benzo treatment. So ultimately, if you do decide to proceed with a taper, regardless of whether the patient has a substance use condition or a mental health condition, slow and patient-centered is the best path forward. Sometimes patients and clinicians want to immediately jump to a conversation about, well, what's going to replace the benzo? And my point is that sometimes it's actually nothing. One example might be a patient with depression who had a benzo started at the same time as their new antidepressant. There was an idea maybe 10 or 20 years ago that this would help with the jitteriness that can accompany the start of an antidepressant. And lo and behold, 5 or 10 years later, they're still on that Ativan when that was never the plan. They were never meant to be on a benzo long term. So I would argue that maybe that patient doesn't need anything to replace their benzo. You want to just taper them gradually and slowly. Another example is a patient whose dog died and they got started on alprazolam. This is actually a true story. 10 years later, do they need a replacement for the alprazolam once you start the taper process? And again, I would suggest no, probably not. They don't need a replacement for their benzo. So just keep in mind that a clinician providing education, reassurance, and support during the taper process, that's a very important intervention that you are offering, even if you're not replacing with another medication. So this really, I would say, is the phase of watchful waiting, where you're slowly proceeding through the taper with the patient, you're listening to them, you're counseling them, and you just see how they do. Again, you might want to be extra watchful if this patient was on that benzo for an anxiety disorder. Maybe you want to consider referring them to a specialty mental health clinician to help through this process, or at the very least, consult with a mental health provider before you make the decision to taper. And again, just proceed with caution. If a patient experienced symptoms during the taper process, again, regardless of why they were on the benzo, regardless of why you've decided to taper, you probably want to assume that those symptoms that you're seeing are withdrawal symptoms and just pause the taper, wait before you reduce it any further, and see if those symptoms resolve or not. Hopefully they will resolve and you can proceed on your way. If they don't resolve after you've held at that dose for several weeks or even months, perhaps you and the patient decide together that you might want to go back up slightly on the benzo dose, and you can hopefully feel good that you still have achieved some amount of dose reduction. And then finally, you might consider maybe there would be an alternative pharmacotherapy if this was a patient with an anxiety disorder. Maybe they would benefit from a serotonergic antidepressant as an alternative therapy. So for our key takeaways, first, tapering a benzo in the presence of a substance use condition is probably appropriate in most cases. Second, tapering a benzo when there's a mental health condition may be appropriate, but first you want to clarify, why is the patient on the benzo? What's their treatment history been up to this point to decide whether tapering that benzo is the right course of action or not? And finally, tapering may not be appropriate in some cases. But if you do taper, you want to go slowly and consider that symptoms that emerge along the way might be related to withdrawal. And so you would just want to pause and exercise some watchful waiting along with your patient. So thank you for watching. For more information on tapering benzos, please explore ASAM's additional microlearning videos and webinars that are available in the ASAM e-learning center.